Hello, my future RN. My name is Professor Pluvios, but you could call me Professor P. Did you know that prenatal care should not start when you're actually pregnant? No, it should start way before. So if you're a student nurse or a nurse who decides to specialize in labor and delivery, or you're just someone who just wants to know about the female body, then this is the right video for you. Stay tuned. Welcome back to My Future RN. So today we're going to talk about prenatal care. So remember, prenatal care does not start when you're pregnant. No, it should start way before. The learning objectives for this video are going to be to develop an understanding of the role of nutrition, diet, and exercise in pregnancy, the importance of performing a thorough interview at the first prenatal visit, develop an understanding of the prenatal labs and the importance of the comprehensive physical assessment, recognize the importance of screening for intimate partner violence, demonstrate a basic understanding of the reproductive and menstrual cycle, demonstrate an understanding of evidence of optimal conception time. So a healthy mind and a body is conducive to a woman having a healthy pregnancy, labor, and delivery. So we're going to talk about diet, exercise, and stress management, how it's important even before you get pregnant and especially during the first trimester of pregnancy. So why is this important? Among women of childbearing age, usually about 20 to 39 years of age, the prevalence of obesity has risen by 39.7% according to the CDC. Two major risk factors are associated with obesity are diabetes and hypertension, which cause major complications in pregnancy during labor and the delivery stage. But did you know that obesity can also cause infertility, congenital anomalies, miscarriages, and fetal death? Obesity is also related to an increased healthcare services and longer hospital stays. So if a patient has chronic diabetes and hypertension, it is important for us to educate them on the importance of diet and exercise, and most of all, taking their medications properly, especially during pregnancy. So here we have a food wheel that shows us how our food should be colorful, because the more colorful it is, the more vitamins and minerals we'll have in those foods. And I have a height and weight chart that shows you for your height what your targeted weight should be. And if it's above this, then definitely the doctor would recommend possibly losing weight. Please remember that if you feel like your diet is not sufficient, just take a multiple vitamin or a prenatal vitamin. Those will give you all of the vitamins and minerals that you need. One of the most important ones is the folic acid. Folic acid is a B vitamin and it helps the body to make healthy new cells. Remember, when you're pregnant, you're building a baby. So we need those cells to be healthy. And folic acid also prevents neural tube defects, that's brain and spinal cord anomalies for the fetus. So where can we find foods with folic acids? Well, vegetables, legumes, dark leafy vegetables, asparagus, spinach, fortified cereals, pasta, orange juice, and fruits are all items that can be where folic acid can be found. Iron is also very important in our diet when we're pregnant. So where can we find that? In beef, chicken, turkey, legumes like kidney beans, lentils, chickpeas, peanuts, sunflowers, and grains such as enriched rice, breads, and cereals, fruits such as raisin, apricots, and prune juice, and vegetables such as broccoli, collard green, and tomatoes, and tofu. So the more iron you have, the more you will decrease your anemia. Next slide, we're going to talk about exercise and its importance. First of all, we talk about aerobic exercise, strength exercise, mobility exercises, and don't forget to do your warm up and your cool down. Regular exercise has been shown to have a wide range of health benefits. There is evidence to suggest that sedentary lifestyle may be an even stronger predictor to mortality, such as established risk factors as smoking, hypertension, and diabetes. So, does this mean that you have to go run a marathon? Absolutely not. But if you do aerobic exercise for 20 to 30 minutes, 5 days a week, then this is known to decrease your blood pressure and to help you to have strong muscles. Strengthening exercise as well. Don't forget to warm up, do a warm up and a cool down, but lifting weights maybe of 1 to 5 pounds and just doing the muscles every day for about 10 to 15 minutes is also encouraged. In pregnancy, mobility exercises are also encouraged. Performing yoga is very helpful to keeping your muscles strong and lean. And they also help you to be very flexible, which is very important for when you're delivering the baby, when you're pulling those legs back, to push that baby out. We need strong muscles and, of course, lean body and mobile joints in order to be able to perform these maneuvers when you're delivering the baby. Like we said before, the frequency, the intensity, the time, and the type of exercise you do is very important. Now let's talk a little bit about stress management. Stress, we all have it, right? So anxiety and depression, we can do a screen for the patient. And we also recommend yoga, Tai Chi, physical exercise, meditation, and spiritual and religion. So faith is a very important aspect also for a lot of patients who come and deliver in the hospital. Um, for example, I had a patient who was delivering the other day, and she kept on saying, I trust my body that God has created in order for me to have this baby. And she actually had the baby without an epidural. So she did very well. Doing these simple exercises and stress relieving management, such as massages, stretching, and yoga, will definitely help us to have a good pregnancy, labor, and delivery. So, what happens during the first prenatal visit? First of all, we're going to do a menstrual history, obstetrical history, sexual and history, social history, type of contraceptives that the patient uses, current symptoms. Are they having any signs of symptoms? For example, vaginal itching or burning, then we need to take care of that. We're also going to do a pap smear, and we also need to write down her gynecological history and any procedures that she had performed, either in her vagina, her cervix, or her uterus. And of course, we're going to do a nutrition screen. The screening for intimate partner violence. We do this on every patient, and it's very important that you do so when the patient is by herself. So, first of all, are there any physical, psychological, sexual, stalking, abuse? Because all of those, unfortunately, happens very often. Keep in mind that different hospitals have different tools that they use in order to assess intimate partner violence. For example, for me, when I um, admit a patient, what I do is I have them come with me to the bathroom. And as I have them change, I ask them, do you feel safe at home? Have you ever been punched or kicked or pushed, shoved, spat at by your partner? And usually they will tell you if they have had those things happen. And if they didn't, usually you could tell. So not only do you want to hear what they're saying with their mouth, but also look at their body language when you ask those questions. Because they may be saying one thing, but in reality, their body language is telling you something else. So for the first prenatal visit, as a practitioner, we are going to get their height, their weight, we're going to perform a physical assessment. We're going to do vital signs on them. And usually the midwife or the doctor will perform a pap smear. And we're going to take a urine sample, for which we're going to do a urine culture and a urinalysis. Do they have any STIs? Okay, we're going to screen for GC, gonorrhea, chlamydia, and herpes, HIV test, HPSAG test, rubella, varicella titer, RPR and VDRL, which tests for syphilis, complete blood count, and a type and screen. So we're going to be drawing a lot of blood. So please tell your patients that we are going to draw a lot of tubes. Some patients get really scared, but we're going to draw a lot of tubes to test for all of these tests. Let's talk about the reproductive cycle for a second. So the first day, as you guys can see here, the first day of the last menstrual period, here we have it as Friday the 1st, because of On average, a woman's cycle is about 28 days. So the LMP, or the last menstrual period, will be the first day that you get your period. Okay, that's called the LMP, last menstrual period. So it's a 28-day cycle. So at half of that cycle, on day 14, that's when you ovulate. And we will increase the chances of you getting pregnant by having sexual intercourse during the 12th or the 13th day, right before the 14th. Let's review the reproductive cycle for a little bit. Remember that everything starts in the brain with the hypothalamus, right? Which is going to make a hormone called gonadotropin releasing hormone. So that will go to the anterior pituitary. The anterior pituitary now will make two hormones that will affect the ovaries. So it goes from brain to pituitary, pituitary to ovary, and the ovaries to the uterus. So the pituitary gland will produce two hormones. The first one is follicle stimulating hormone, which will tell the ovaries to make a follicle to grow or mature an egg. And as that follicle grows, it will make estrogen. And the estrogen, in turn, will start to thicken the endometrial lining. Around day 14, now LH, luteinizing hormone, will grow, and FSH will go down a little bit. Then the luteinizing hormone will tell the ovary or the follicle to go ahead and release that ovum. Once ovulation occurs, then what is left is called a Graafian follicle. The Graafian follicle, in turn, will produce progesterone, which will further thicken the endometrial lining. So that's the reproductive cycle in a nutshell. Okay, so the brain to the pituitary gland affects the ovaries, and the ovaries affect the endometrium, which is the inner lining of the uterus. So knowing this, how can we increase your chances of getting pregnant? Well, one method that we can use is the basal body temperature. Basal body temperature. So basically, we tell our patients to take their temperature every day for a month just to see how their body temperature changes. So before you even put your feet on the floor, have your thermometer at your bedside table and just take your temperature. So let's say your temperature is 97.5 every day. But then on the 14th day, you see that it rises to about 97.9 or 98, then that tells you that you're possibly ovulating. Now, when this happens, this is the time to have fun with your significant other, okay? And have sexual intercourse, because this will increase your likelihood of becoming pregnant. Optimal time to conceive. What are other indications for that? Well, one thing that we can do is cervical mucus change. Yes, I said it correctly, cervical mucus change. So basically, I tell my patients, go ahead and wash your hands, and every day you're going to introduce two fingers into the vagina, take it out, and you're going to just squeeze it in between your index and your thumb. Now, if the mucus, as you can see on the right, is very thick and opaque, then it's not the time to have intercourse in order to conceive a baby. But if it becomes thin and very clear and stretchy, then you know that it's time to have intercourse, because now your body's more open to having the sperm come in and for the egg to be fertilized. Yes, party over here. So then eucoital, acoital, everybody coital. Okay? Have fun in making your baby. All those little sperms are going to rush and go to the fallopian tube where the egg will be waiting to be fertilized. And usually that happens day 13 and 14. So in review, we have learned that a physical and psychological assessment is very important for the patient. We also perform a comprehensive history taking, a physical assessment and diagnostic tests, proper nutrition, exercise, and diet, and the importance of taking a vitamin supplement every day. Also, assessing for UTIs or STIs, and the best time to conceive. Let's see if you guys paid attention. Relax, you got this. I'm just gonna do a little test just to test your knowledge. Okay, so I'm gonna read it. It says, a client and her husband come to the clinic. They have been trying to conceive for the past 6 months. Which of the following statements made by the client indicates they are having difficulty coping with the infertility regimen. Which one of the answers? I'm going to give you guys a few minutes. So just pause. You can pause the video for a second and tell me which answer do you think is best. Well, if you pick number 4, my husband just hates having to be on a schedule to make love, then that is the right answer. And the reason why I say this is because you both have to be on board. Your husband has to understand that it will take time, or your significant other has to understand that it will take time to have this baby, that you're doing the mucous cervical changes, and you're also doing your basal metabolic rate. And so on the 13th and 14th day, this is the best time to optimize for sex. So if he's not with it, then it's not going to work. So we really need for him to be psychologically ready in order to have intercourse only on those days. Which of the following statement made by the client indicated the need for further teaching? So whenever it says indicates a need for further teaching, we're looking for the wrong answer, right? So to become pregnant, we should, please pause the video. It is number 4. Don't have intercourse the week after my menstrual ends. Now, why is this the right answer? Because number 1, 2, and 3, they all increase your likelihood of conception by timing intercourse around the expected time of ovulation. But number 4 decreases the likelihood of becoming pregnant and indicates a need for further teaching. Test your knowledge. What foods are high in folic acid? Oh, I did review that. What foods are high in folic acid? Please pause the video and try to choose an answer. Which foods are high in folic acid? Yay! If you got B, you got the right answer. So spinach, kale, greens, asparagus, all green leafy vegetables are high in folic acid. True or false? The hormone that maintains pregnancy is called progesterone. What do you guys think? If you said true, you got it right. So thank you so much for watching. We're going to have plenty more videos, so please like, subscribe, share, and comment. And don't forget to press that notification bell so that when we have other videos coming, and we will be having other videos coming soon, you'll be notified and you can watch them as well. So this is my future RN saying goodbye.